sharp ache in your shoulder every time you reach out away from your body or reach behind your back to tuck your shirt in or reach for your wallet, that's not normal. My name's Dr. Nick from Preferred Physical Therapy, where we specialize in helping folks over 40 stay active and independent, live free from painkillers, and avoid surgery. And to help you better understand your condition, I'm going to go over some basic anatomy of the shoulder. So some quick and easy anatomy of the shoulder is we have the humerus bone, which forms this golf ball looking end of the joint. We have the humerus, which comes up and forms a golf ball at the end. That golf ball sits onto the glenoid. The glenoid is a part of the shoulder blade or scapula and kind of forms this golf ball on golf tee relationship, meaning the golf ball is much larger than the tee. We'll get into more about what that means. We also have this acromion, or this spine of the scapula that comes out and forms an acromion. We call this space underneath here the subacromial space, meaning below the acromion. And this is important to understand because right here on top, we have this kind of valley-looking feature, and that's where one of the rotator cuff muscles called the supraspinatus actually sits. And this is the most commonly torn rotator cuff muscle, is the one right on top here. And that's because of its relationship between where the golf ball is as it comes down and inserts right over here on the tip of it. Every time we raise this arm up, you see how this humeral head gets closer to the acromion, or that distal tip. Every time we raise up overhead, we have opportunity for it to pinch right underneath that acromion. So imagine if I had a rope that comes out, attaches here on the end of the humerus. Every time I raise my arm up, if I don't have everything working correctly, I'm going to get rubbing and irritation and fraying of that rope across the end there. And that's the rotator cuff. And I say most commonly, as in like 70%, it's exclusively the supraspinatus, and 91% of the time, it's supraspinatus, and sometimes the infraspinatus muscle, which was a muscle that will sit right underneath the spine of the scapula, and then come out and insert kind of high on the golf ball, and then come down the backside of the golf ball just slightly. And so 91% of all rotator cuff tears involve one or both of those muscles. The other features of this shoulder is the collarbone. Now, remember, the collarbone is the only bony attachment we have of the entire shoulder girdle and arm to the body. I mean, this pencil-thick bone is the only thing that structurally connects the whole upper arm and shoulder to the body, because the shoulder blade is free floating, meaning there's nothing connecting it bony. There's no bone-to-bone contact of the shoulder blade down to the body. It's all muscular. And so because it's so muscular and there's so much dynamic stability, meaning non-structural stability to the shoulder, it has a problem with getting injured. Unlike the hip, where if you look at the hip, there's actually a bony congruence. There's a socket where the ball will sit inside the bone and be quite stable, quite rigid. The shoulder is not that way. It's unique. It demands the stability of that rotator cuff to keep the golf ball sitting on the golf tee. And when that's not working correctly, we have breakdown and problems, particularly more irritation and fraying across the top. The other thing that you notice feature-wise is we have this little groove right over top of this humerus bone right in front. And that groove is where the bicep tendon will come up and then insert right on top of the golf tee called the glenoid. So it'll come in and insert right on top. What's also unique about the shoulder is because we have so much mobility in that shoulder, it requires a lot more soft tissue stability. While we have contractile features like muscles and tendons that will stretch and allow for some stability, the other soft tissue features that are non-contractile or non-shortening or lengthening are things like ligaments and joint capsule. Part of this joint capsule feature is thinking of it like a balloon that will encompass the joint and try and keep as much of it together and in the right spot. The labrum is a feature of the golf tee. Think about the golf tee being so firm and rigid. The labrum is then a soft tissue extension on that golf tee to try and make it more stable. But it's soft, meaning that it can bend and move, but it doesn't stretch. And so anytime we get too much pulling or yanking on that labrum, we can cause tearing. And most commonly, we see that tear occur with a bicep tendon as it inserts, and really, we call it an insertion, but it's a perfect blend and becoming of the labrum as it then comes and anchors into the glenoid on the top rim of the glenoid. And so where we get problems is if we get yanked on a bar overhead, or if I'm reaching overhead and then I get yanked across, we often can get labrum tearing or pulling away from the bone, causing more pain and dysfunction. And so one of the features that you're going to see here is that we're going to try and make sure that we have as much of the space underneath the shoulder to be as clean, as healthy, and as mobile, and without pinch. So a lot of folks who have rotator cuff pain in this area or any bicep tendon irritation is when they reach overhead, we get this pinching, pain, and then it often will lighten up overhead. We call this a painful arc. And that painful arc is a very common description of any kind of impingement or irritation on the underside of this acromion. So the reason why you'll have pain when you reach behind your back is because of this internal rotation. This internal rotation stretches this infraspinatus muscle. So we have a tear or irritation on the infraspinatus muscle, which is, again, one of the most common injured or torn muscles of the rotator cuff. By internally rotating and then coming back behind, we get a big stretch across this infraspinatus and rotator cuff complex. And because we get this stretching, imagine, again, if I have a rope that comes down and inserts on the top and a rope that comes in on the back and inserts here, I'm bending away and rotating away to reach behind. And so both of those muscles can get irritated anytime we do that, which is why you'll have pain often reaching behind your back anytime we have an irritation across those two muscles. That's just 2 of the 4 rotator cuff muscles. The other one is underneath the shoulder blade, and the last one, it comes across the edge of the shoulder blade and then comes right across underneath your collet teres minor. Those all assist the subscapularis, the one on the underside, pulls our arm to our belly. It's not often irritated. It sometimes is if we have a fall with our arm reached out in front of us. So folks, we see this with volleyball players or others who are diving out in front and then landing hard. Some folks who take a fall or a slip and they're trying to reach out to break their fall and they still kind of drop down heavy at an outreached arm. Those muscles can get irritated. Folks who a lot of bench press or a lot of pressing away can also get irritated across there. And teres minor doesn't often get irritated. In fact, it won't really get torn, but it does get strained. And it can often get strained with any kind of too much pulling towards your body, or commonly overhead throwing, swimming. Anytime we're trying to slow down our arm as it goes away from our body is one of the features of the teres minor that will cause some strain to it. And so going over some understanding of what a strain versus a tear, and the reality is that a strain is just one way to describe some degree of tear. Often folks, when I describe to them what a tear is, and this is very common with rotator cuff tears, is we have one feature that's connected, and a tear is now taking one feature and making it 2. So it's a tear across, like if I have a sheet of paper and I tear it in 2, that's a tear. Well, the reality in muscles is we have degrees of tear. So that is 1 degree. We call that a 3rd degree tear. We have a 2nd degree and a 1st degree tear. And a 1st degree tear is almost like muscle soreness. After a workout, we get some degree of separation of those muscle fibers. A grade 2 is when we have significant amounts of separation of those fibers. That can cause some bruising. That can cause slow healing or long-term soreness and pain, even some sharp, dull ache that can happen, particularly at the end of the day or towards early evening when you've been using it. Like, it feels good to use it and warm it up. It feels pretty good. And then towards the end of the day, it starts to ache. That's because those muscles have been overworked. If you do have a muscle strain, in this case, a rotator cuff is a description of 4 muscles. Don't think of it as anything else. It's 4 muscles. Anytime you have a strain across those muscles, some degree of separation, you will have soreness and pain. Most commonly, we see a lot of grade 2 strains. It's still a tear, but it's a strain. And with a grade 2 strain, you'll notice as you warm up and get moving, it feels pretty good. Not all the way, but it feels better than otherwise. But then as you sit down towards the end of the night or the end of the day, it gets a little bit more achy. And that's just because it's not moving and it needs that blood flow, it needs that mobility to stay elastic. And when it's not elastic and then we go to move, it's painful. I see a lot of folks who complain about this at nighttime, hard to get comfortable, hard to get to sleep. When they move, they roll over and they move their shoulder just right or just wrong, and then they have pain. And that's because it hasn't been moving. It's not elastic. It's not warmed up to that compression and decompression and elongation of the tissue. And then we do so rapidly or quickly. It's not even so violently, but just rapidly enough to where now it's irritating and painful. If you are having pain when you reach up away from your body or reach behind you, and you're noticing you're having that ache at the end of the day, what we do know about any contractile tissue, that's muscle and tendon, is they respond really well to controlled lengthening, easy stretching, and also resistance training. They need resistance training in order to recover. And I know it sounds crazy, but just like fighting forest fires with fire sounds crazy, similarly, what we need to do is dose the exercise or dose the resistance appropriately to get the intended effect, which is not more pain, but more recovery. The worst thing, the absolute worst thing you can do with any kind of shoulder injury is keeping your shoulder tight to your side and not doing anything because it hurts. If you start doing this, you're going to start to develop a condition called adhesive capsulitis or frozen shoulder, an entirely different and avoidable condition as long as we take care of our rotator cuff tears appropriately. If we do not, we will get more stiffness, more pain, and in the end, more limitation even after we rehab it. The first thing that we want to do is improve your mobility, your pain-free motion. So there's a couple ways to do that. I'll show you two. My favorite one is if you get to a countertop or a table, put your hands on top of the table, just walk your way back, and then lean back and stretch your arms overhead. Now, nice and easy, just a little bit of stretch, then you can come back up. I like to hold 5 to 10 seconds down below. Make sure you have no back pain. I like a split leg stance, so one foot in front of the other, and then lean back. You're going to hold 5 to 10 seconds. Make sure you push your elbows straight. We don't want too much bend through the elbows because we're going to take away opportunity for the shoulder to get stretched. So keep your elbows straight, lean back, and hold 5 to 10 seconds. The reason why I like this position is because you can then move to go thumb up, and then you're going to lean your shoulder and hip to opposite side. So you're going to lean away, and that's going to change the angle that we get a little bit of overhead. So we can go straight on, 3 to 5 seconds, and then opposite side, 3 to 5 seconds. And just changing the angle is going to improve how much mobility we introduce to a very dynamic shoulder. Again, 3 to 5 seconds, 10 to 20 times. The idea here is not to get more ache and more pain by the end of the exercise. Keep it simple, keep it moving. If that means that you only get to here before you have pain, great, stay right there, 3 to 5 seconds there. Each time we're going to try and go a little bit further, but if we can't, that's okay. Be patient with yourself. It's okay. The idea is not to get more pain. You don't need more pain to get more benefit. That is not the case. If you're having shoulder pain, you should do this every single day, sometimes twice a day, until that shoulder pain starts to go away, or you're able to get the full range of motion, the full movement. If you're having a hard time with the previous exercise, my next favorite is table slides. So put a towel down, you're at your kitchen table or your countertop, you're sitting down next to it. This is my hurt shoulder, and I'm just going to reach with that towel, reach out and slide forward. I'm using my body to help get that movement for my shoulder. I'm going to slide back in, and then I'm going to go palm up, palm up. I like to hold on to the towel, so palm up, and then I'm going to lean towards that same shoulder. So we're changing the angle of the stretch that we're challenging. 3 to 5 seconds, same kind of thing, just easy. The idea is more movement, more repeated, repetitious movement without pain, 3 to 5 seconds, come back in. The other feature, notice, I'm not letting my head drop. If I let my head drop and sag down, there's enormous connections between the neck and the shoulder. So many of the muscles that help stabilize and connect to the shoulder come from the neck and vice versa. And so we want to make sure our neck is very stable as we do these movements. So again, not letting it drop down. We keep it up and high, as neutral as possible. We do this for the same amount of reps, 3 to 5 seconds, 10 to 20 times, 1 to 2 times a day. If you're having any stiffness on the other shoulder but no pain, I highly recommend you do this to both shoulders. You will see a significant improvement in your mobility as you do it to a non-painful shoulder that still requires improvement in its mobility. The longer your joints and tissues stay elastic, the more mobility and the less arthritis you're going to have. The next technique I'm going to show you is to help improve mobility of your thoracic spine and your rotator cuff at once. And the reason why your thoracic spine is so important, is so key, is because if you remember that subacromial space, that acromial hood that we have over top of our shoulder, well, if our posture is starting to get stiff and limited and we're crowding down this way, that subacromial space closes down. And now it's much easier for that rubbing and fraying to occur every time we raise our shoulder up. And so this next technique I'm going to show you is a way to help open up our chest and shoulders, as well as improve the mobility of external rotation, which is going to help stretch out the front part of our chest. So what you're going to use is a towel, just a hand towel, and a dowel rod. This could be a golf club, baseball bat, a broom, any of those things will work just fine. And so with the hand towel, you're just going to take it, fold it hot dog style, and then just roll it up. Doesn't have to be too fancy. Roll it up, and you're going to put it under the elbow of your painful shoulder. Okay? This is going to go under the elbow of the painful shoulder. I want to squeeze that into my body and hold it there as I then take the golf club or dowel rod, brooms, whatever you have, palm up, and I want to push out this way. Now notice I'm big and tall through my chest, trunk, and shoulders. The more vertical, the more upright you stay, the more you open up that thoracic spine, as well as maintain opening of the subacromial space, which we talked about earlier. Now, as we get out to where it's feeling a stretch, okay, great. Hold it there, 5 to 10 seconds. Stay big and tall, and then relax and come back in. You're going to do this 10 to 20 times. Now, this stretch is going to feel a little more subtle. It's not going to feel like your typical hamstring stretch. You will still feel a stretch, but it won't be as obvious as like a typical hamstring or muscle stretch. So be patient with that. Allow that to be the case. We're getting a little bit of capsular stretch. We're getting some soft tissue stretch, some structures that are not typical to just muscle sensation. So be patient with that. That's okay. It's what we're going for. The biggest thing I want you to remember is staying big and tall. Sometimes I'll have folks do it on a wall just to help cue them of how vertical I want them to be, to then be able to get that stretch to open up and to keep that subacromial space clear. What you might notice is you can't go out as far as I can, and that's okay. What I want you to do is go as far as you can with as little pain as possible. Once you get to that point where it's like on the threshold of discomfort, stop right there and hold 5 to 10 seconds. So that could be you're here, and that's okay. That's where you begin. Ideally, as we go along, we want to see it get further and further, get more and more open, not at the cost of more pain. If you're having increases in pain or discomfort in your shoulder with this move, then don't go so far. I'm okay. If you're pain-free through this range right here, that's okay. The idea is we want to get and introduce as much movement into that shoulder as pain-free as possible, as much as possible, to allow that shoulder to nourish, to move, and to become elastic again. That's what I want you to focus on to improve your mobility. Now I'm going to show you some resistance exercises. Now, if this is my hurt shoulder, you're going to go back to your kitchen table or your countertop, put a towel down. We want to cushion the elbow. It should not be uncomfortable on your elbow. And what you're going to do is sit up big and tall. Start out with no weight in your arm, and you're going to work rotating up to 90 degrees or as far as you can. So I'm big and tall. That's the biggest feature. Do not get caught sagging down or slouching. Get to the edge of your seat, sit up big and tall, get vertical. Arm is going to be bent here, resting on the table or countertop, and you're going to rotate up. Now, you can see how the height of the table or countertop is about mid-ribs or just below my armpit. That's totally fine. We don't want it too low. If it's lower than about middle of your ribs, see if you can find somewhere to get a little bit higher. Put a pillow down, put a cushion down, get something to elevate it just a little bit, because we want about 30 degrees away from our body to be able to do this exercise correctly. 30 to 45 degrees away from our body to be able to do this exercise correctly. Now, if you do 30 of these and have no pain, no problem whatsoever, great. Grab a soup can. Grab something a little bit light. 1 to 2 pounds is about all that you need to feel enough resistance to work these muscles. The magical feature with our rotator cuff muscles is they are not big power movers. These are subtle, small, postural stabilizers. We want to train them in ways that they're going to be used, which is through endurance. So high rep, low load. High volume of reps, low load, low resistance. So a soup can, 1 to 2 pounds, no more than 5 as you build up. Keep it light, because we want to get to 15 reps, to 20 reps. We want to feel muscle fatigue, muscle burn, but not pain. The other thing that you're going to notice is I'm keeping my elbow here bent at 90 as I go up. So my forearm then becomes perpendicular or to a 90 degree away from the flat of our table. Big and tall. 2 sets of 15 to 20 reps. High rep count. Low weight. The next, you're just going to scoot away. Elbow is still straight. Arm is out to the side. And from here, we're going to work on lifting off. I know it sounds silly. If we have any kind of pain, we want to stay big and tall. I lift off, hold 5 seconds, and then come back down. Keep it very light in your hand. I say this with advanced caution because so many people are going to try and get something a little bit heavier, and it does not take much to feel that load. I'm dosing this 5-second hold 10 times. If it's feeling too light, do 15 to 20 reps at a 5-second hold. If you've proven that that's okay for the first couple of days, then go ahead and add a soup can. I caution you and urge you to go slow with this exercise because it can easily be irritating if you do too much too soon. We're trying to recondition these muscles, and we need to do so cautiously, but appropriately. And doing too much because we're in that no pain, no gain mentality will end up causing more damage than doing more good. And so keep it easy, keep it light, work on increasing the rep count first before you increase the resistance. So if you do this for 10 reps, a 5-second hold, do 15 to 20 and see how you do. Do this one time a day is all, and you can do this 3 to 4 times a week. Don't worry about doing this every single day. As you do so, then you can begin to add more load. Up, hold, and then come back down, nice and slow, no pain again. Vertical, elbow straight, out, no weight. Now you notice I'm not straight onto the body, I'm not straight out to the side. I'm in what we call the scapular plane, or this kind of 45-degree plane away from our body. This is the angle that's been shown to be most productive at initiating that firing of the supraspinatus muscle specifically, in as much isolation as we can, even though it's not a perfectly isolated move. The other thing I want you to work on, if you're noticing, if your first move is here, shoulder up to our ear, be very cognizant of that. We want to mute that. We don't want that to happen. So the cue to do that is I want you to think about reaching out in front of you. Reach out and then raise the arm. As you reach out forward, kind of away from the table, and then raise up, you're going to notice that keeps that shoulder down. If you can't do it without the shrug, then I want you to bend the arm. That's going to lower the amount of resistance or load that you put on. And then from there, I want you to be able to get into a spot. We'll see how, if I come in too close, see how my shoulder, I need to get either a pillow under my seat, I need to get up a little bit higher so that I can rest my elbow at the right height. Luckily, I can lower this table, and I want to get it so if I do have pain with that at first, then I'm going to work on keeping my elbow bent and that lever short so I don't have as much load if my arm straight is too much. And then you're going to hold and then come back down. If I'm getting shrugged, the first move that's going to happen is I'm going to do this to try and elevate my arm. This is not what we want. We're getting too much trap involvement, and that's going to close down our supraspinatus. We want to stay, this is down, and think about reaching out. The more we reach out, that pushes that shoulder down, and we're getting the supraspinatus muscle to fire, which is the one that we want. So think about reaching out in that 45-degree plane, that oblique plane away from our body, and holding. The other thing that you might notice is if you're having a hard time with that, holding a dumbbell on this side and doing them together, you will notice it'll be easier to get this arm out if you have a dumbbell in your opposite hand or your non-involved hand. You can do them together at the same time and hold, but put a weight or a dumbbell on this side, and that will help you with that reach. So if you're having that sharp pain, that sharp ache pain in your shoulder as you reach away from your body or behind your back to tuck your shirt in, these exercises are perfect to help you find relief at home. Again, a reminder, do not look for pain. We don't want more symptoms with any of the exercises. If you're doing other exercises and you're getting more pain in your shoulder, calm it down, go back, reset, revisit what you're doing and why you're doing it, and make sure that we're getting a no pain but progress with the exercise. We went over some of the anatomy to help you understand why these exercises were chosen for this condition and why specifically they're going to help reduce or eliminate your ache as you reach away from your body and behind your back to tuck in your shirt. If you have any other specific questions, feel free to leave those in the comments below. I do get back to them. If you found any help at all with this video, please consider subscribing. Basic anatomy of the shoulder, and to help you better... We've just talked about it, Nick. We've just talked about less. The first thing we want...